Ever since COVID, the nursing profession has taken on a lot of new responsibility. The new culture is that we can do more with less. The nurse in 2024 often has to deal with being short staffed, unsafe patient to nurse ratios, not being able to take a lunch break, having a high acuity of patients, and taking on multiple roles, to name a few. Several nursing tasks that require the nurse's time and attention. Oftentimes, there aren't enough nurses or enough time in a shift to complete these manual processes. Examples of these problems include needing a second nurse to verify medications or the important task of educating a patient. Current and future staffing challenges are driving nurses out of the profession due to these stressful conditions. Nurses are central to the healthcare industry, and a solution is needed to retain our current and future nursing staff. Virtual nursing is a hybrid care delivery model, meaning that care is delivered both in person and remotely via technology. The virtual nurse has access to hear and observe inside a patient's room via some form of portable technology, such as a monitor. Virtual nurses can help with tasks of education, discharging, second nurse verification, and to assist with potential medication errors, just to name a few. All these time demanding tasks can help reduce the burden upon a bedside nurse. Is Mary, the med-surg nurse. She has 5 patients in total. One patient needs a blood administration while another has been waiting for pain medication. Mary's third patient's vital signs are abnormal while her fourth patient needs to use the bathroom. Additionally, her last patient has been waiting to be discharged for at least an hour. Mary is feeling behind and in need of help, but the rest of her floor is equally busy. Normally, Mary would be extremely overwhelmed. However, her hospital has a virtual nurse available. Mary delegates the discharge task to the virtual nurse, which lifts a significant weight off her shoulders. Several studies have been conducted on the use of virtual nursing in inpatient settings. Nurses communicated several improvements in areas such as having an instant nurse for dual medication verification, mitigating nurse burnout, educating patients, faster triaging, and expert clinician oversight. Having an extra nurse virtually helps to give back time to the inpatient nurse whose time is limited due to various manual tasks. The extra time given back to the nurses can be critical in life threatening situations or even simply in reducing burnout. Mary, the med-surg nurse, was on the verge of finding a new hospital because she was so burnt out, even though she had only been at her current hospital for just a few months. With the implementation of a virtual nurse, Mary is feeling more supported and less burnt out. One organization that has implemented virtual nursing noticed a 35% reduction in their nurse turnover rate. Working with a virtual nurse allows the inpatient nurse to delegate manual processes, which in return improves patient and nursing satisfaction. Nursing is a constantly evolving profession. Nursing in 2024 and beyond needs to look different in order to retain current and future nurses. Utilizing a virtual nurse is still a new idea, but has proven to be successful thus far. As nursing evolves, our use of technology will evolve too, creating a safer place to be both a patient and a nurse.